Hello everyone, in this video we are going to discuss about ventilation-perfusion ratio. Ventilation is air reaching the alveoli. It is measured in liters per minute, and perfusion is blood reaching the alveoli. It is measured in liters per minute. So both the units are same, so it will be a ratio, V by Q ratio. So before going to the V by Q ratio of the lung, we have to know the zones of the lung. It is divided into zone 1, 2 and 3. Zone 1 is at the apex, zone 2 is the middle zone, and zone 3 is the base. So we have to know three pressures also: pulmonary alveolar pressure, arterial pressure and the venous pressure. We know the pulmonary artery will carry deoxygenated blood from the right ventricle. Pulmonary artery will carry it to the lungs where it get oxygenated, and it reaches the oxygenated blood reaches the pulmonary vein, and then from there it will reach the left atrium, left ventricle and whole body. So here pulmonary alveolar pressure is very much high at the apex, so compared to the pulmonary artery and the venous pressure. So the vessels will collapse here, so the perfusion will be very less. And in the second zone, the alveolar and the arterial pressure is almost equal, so there will be moderate perfusion. And at the zone 3, the alveolar pressure is very much low compared to the artery and the venous pressure, so there will be very high perfusion. So compared to this, since there is very low perfusion, denominator is very low, so V by Q ratio will be high. Here both ventilation and perfusion is moderate, so V by Q ratio will be normal or moderate. At the base there is very high perfusion. Since the denominator value is high, there will be very low V by Q ratio. So at the apex, the alveolar size is large at rest, but at the bottom the alveolar size is small at rest. So the compliance is very low at apex compared to the base. So the ventilation will be low compared to the base. So and the perfusion is dependent on the gravitation. So gravity. At the apex the perfusion is low compared to the base. So V by Q ratio will be very high at the apex, and at the base it is low. So coming to the concept of dead space and shunt. Whenever there is perfusion is absence, whenever there is absence of perfusion, it is dead space. Whenever there is absence of ventilation, it is shunt. So V by Q ratio, the perfusion is 0, so it will be infinity. The ventilation, the numerator value is 0, so V by Q ratio will be 0 here. In cases of shunt, oxygen therapy is not useful as it does not enter the alveoli. So coming to this, V by Q ratio is 0 in shunt and infinity in dead space. There will be no ventilation in shunt, no perfusion in dead space. Here, even though there is perfusion, there is no ventilation, so it will act like like blood is being shunted from right to left without getting oxygenated. So in dead space there is ample amount of oxygen, but it is not getting perfused, so alveoli are getting unused. So clinical example of shunt is ARDS and other atelectasis, foreign body pneumonia, and in dead space it is for vascular causes like pulmonary embolism and low BP. Oxygen therapy will be poor with shunt. It improves with oxygen in dead space. Gas exchange, no oxygen enters the alveoli, blood remains deoxygenated here because there is no ventilation. In dead space, no blood itself is there to receive oxygen from the alveoli. So V by Q ratio, in normal V by Q ratio is 0.8. It is healthy lung. It is less than 0.8. Whenever if the perfusion is normal but ventilation is reduced, then it is asthma. It is purely a ventilation cause, that is asthma, chronic bronchitis and early pneumonia. It will improve with oxygen. Very low V by Q ratio is seen whenever the perfusion is normal and ventilation is 0. It is seen in ARDS, atelectasis and foreign body severe pneumonia. So when the ventilation is absent, it will act like a shunt. So V by Q ratio 0 is shunt. High V by Q ratio more than 0.8 is when the perfusion is slightly reduced, like not completely 0, but it is reduced compared to the ventilation, like is seen in partially blocked pulmonary embolism. Infinite V by Q ratio is dead space where there will be no perfusion, so it will be infinity V by Q ratio. All the conditions almost improves with oxygen except the shunt, which does not improve with oxygen. So coming to the zone 1 apex, we know where there will be low ventilation, low perfusion. But the perfusion is very less compared to the ventilation, so high V by Q ratio. Zone 2, moderate ventilation, moderate perfusion. So V by Q ratio is normal. At the base, there will be very high perfusion and also high ventilation. So since the denominator is very high, there will be V by Q ratio is 0.6. So let us see a clinical scenario. A 45-year-old woman comes to an emergency room with a sudden onset of shortness of breath and pleuritic chest pain. After knee surgery, tachypnea is there, heart tachycardia is there, oxygen saturation is 88%. ABG shows PaO2 60, PaCO2 32. CT pulmonary angiogram shows pulmonary embolism. They itself here they gave a hint. So pulmonary embolism means perfusion is 0, Q is 0. V by Q ratio will be ventilation by perfusion is 0, C is infinity. So V by Q ratio will be infinity here.